So, all right. Hmm. So we're looking at the role, the cervix role in labor. And I said this cervix is the silent gatekeeper that decides when your life will enter the world. Silent gatekeeper. Oh boy. You'll be amazed at the kind of information we're going to share tonight. Right? The cervix is an unsung hero of labor. Everybody talk about everything when it's time for labor, but nobody's praising the cervix. When people talk about childbirth, they often focus on contractions. They focus on pain, the pushing, and even the baby, right? But that one small structure that silently controls the entire process, nobody talks about it. And that is the cervix. The cervix is the silent gatekeeper. The silent gatekeeper is the cervix. So no matter how long the contractions are, no matter how ready the baby is to come out, if the cervix is not ready, birth cannot happen. Birth cannot happen. It can never happen. The cervix is the gate keeper of life. Cervix. Nobody sees it. Okay, your matron and doctors, they see it because when they look through the vagina, they get to see it, right? But it's the silent gatekeeper that determines my coming into this world. And blessed is the service that bettered me, because now I'm a blessing to millions around the world, right? So you want your service also to be a blessing, not a selfish one that produce selfish people that think for only themselves. That's not right. All right. So, what is the cervix anyway? Oh boy, if you're ready to hear this, you have to type on the comment section "ready" before I begin. What is the cervix? And as usual, I'm going to make it very simple for even the layers of men to understand. It's not rocket science, right? It's not rocket science. It's just simple biology. Yeah. What is cervix? Anyways. Yeah. All right. Before I talk about the cervix, you don't want to miss. I keep on emphasizing. You don't want to miss the next season of our learning. The next season is actually restructured, rebranded, and is targeted at those that are trying to conceive. So if you know anybody who has been trying to conceive for years and they are still struggling, please get them to join the live stream every day, Mondays to Friday, 7 p.m. Nigerian time. Right? Do that. That is the best gift you can give those people in the year 2026. Right? So get them to come. Let them come and learn. Let them come and hear things that will change their life. Because we're going to start from the beginning. The same way we did with this season, actually, Journey to Parenthood. The same thing we're going to do in the next season. So that everybody that is trying to conceive would understand from the scratch the things that is in their control, the ones that are not in their control, right? What they should do and what they should not do, and when to make the decision. Anyway, the time to make decision on having children, the time is now, right? I know that some people get married and they say, "Oh, I just want to enjoy with my husband for the next 10 years before we start." Biology don't wait for you. Fertility is a time process. So while you are waiting for the 10 years to begin to have children, also have at the back of your mind that the biology will not wait for you, right? So these are the kind of things we're going to be exposing in the next season and help people make the quick decision and the right one so that infertility will become a thing of the past, right? And as usual, if you're going to join the second season, make sure you come ready to tap on your screen, because your tapping is what gives other people the opportunity to see us and learn, whether in the FYP or those that are in the viewers are. Everybody should learn. They deserve knowledge, even though not everybody appreciate knowledge. In fact, from my experience, 80% of the people don't appreciate knowledge, right? And that is why they cannot keep the results even when it comes, because you cannot cast pears amongst one. It's not going to stay, right? Is that Christy label is here? It's not going to stay. All right, so that's all this I said is just to prepare us for the next season. And the theme of the next season is, why are you not pregnant? That is the theme for the next season. And every episode is targeted at those that are trying to conceive. If you listen to me long and hard enough, you will be pregnant just by listening. Because knowledge is all you need. All you need is knowledge. Somebody came to me today and said, what medicine should I take so that I'll be pregnant? I said, no medicine. There is no medicine. Of course, I can decide to, bring money, I consult with you, cause you to spend money all over the place. I don't do this for that. Right? The money is good, but how do you deceive people? Because it's not right. You want to help. You don't want to help, get out. What's the purpose of deceiving people because they're in desperation? It's not right. And nothing can be as wicked as that, especially when it comes to raising a family. If you are just joining, you're welcome. You want to make sure you are following me. Share the live and tap on your screen. Give other people opportunity to learn tonight. Right? So we're discussing the cervix role in labor. So much information is packed. We've not started yet. For those of you that are asking questions, make sure you are following me. If you are not following me, I will not answer you. Why? Because you said you don't want to be my friend, but I should answer your question. It's not going to work, right? And for those who are already my friends, we're going to wait. Let's talk about the topic for today. Then we will take your questions and answer it in details, leaving nothing in doubt, right? All right, let's begin. And if you have not dropped a heart me yet, this is the time. This is the time to drop a heart me. This is the time to drop a heart me. All right. So, what is the cervix? What is the cervix? This glorious cervix that we are talking about. We call it the hidden gateway to life entering this world. right? So in the simplest possible time, please make sure you have a pen and paper and write something down so that you don't forget the things I'm telling you. Yeah. The cervix is the the lower part of the uterus, the lower narrow part of the uterus. Unfortunately, TikTok does not allow sharing of certain slides. The way TikTok is designed, if it's not on background, you cannot share slides. So I'm not ready for that stress. So I'll just leave you to your imaginations, right? So that you too can go and just browse images for uterus, then you understand what I'm saying. So the cervix is the lower narrow part of the uterus, right? It is the doorway between the womb and the vagina. So if you look at the anatomy, what do you see? Coming from outside is the vulva. Whatever you see is the vulva. Then the passage that enters into one of the passages, because there's another one that enters the bigger passage anyway, that enters through the vulva is the vagina. At the end of the vagina, the cervix picks up from there, run a short distance, then it continues as the uterus. So the cervix is the lower narrow part of the uterus, and it is the doorway between the womb and the vagina. It is the doorway. Good evening, you're welcome. So you want to think of the cervix like this. It's like a tightly closed door during pregnancy, right? And it slowly opens during labor. So in pregnancy, it is tightly closed. When labor begins, it gradually and slowly begins to open. And we have a lot of that gist tonight. In fact, you will understand so much tonight that you will be left in no doubt. All right. Now, during pregnancy, the cervix during pregnancy, the cervix, not the uterus. The cervix, we're talking about the lower narrow part of the uterus. That's the cervix. During pregnancy, the cervix stays long. Yeah. Besides staying long, it stays firm, right, and closed. His job is a gatekeeper, so it's got to be closed, right? And interestingly, during pregnancy, it points backward. It points backward. Its job, the job of the cervix, is to hold babies safely. The reason why when some people have is uh, uh, insufficient, is it insufficient now? Incompetent cervix, pregnancy cannot stay, because you need that cervix to hold the pregnancy in place. That is one of its purpose. The cervix, beside holding the pregnancy in place, also prevents infection. Remember, the vagina is exposed to the atmosphere. So, of course, it has its normal flora of bacteria, and it's also open to environmental flora and environmental bacteria. So, because of all those shenanigans happening at the vagina, the cervix has to maintain that the sanctity of the uterus by staying close and preventing infection. Right? The cervix prevents early labor. If it's not time, that baby is not coming out. That is the job of the cervix, and that's remarkable. That's remarkable. So, do you understand anything up to this point? I'm trying to make it slow and simple enough for everybody to understand. Do you understand? If you understand, talk to me in the comment section. Type understand so that I will know that you are there. If you are still there, type understand. All right. All right. So, Lady G, this service discussion is basically for you. It's basically for you. All right. It's basically for you. All right. So, let's go ahead. So, if you are just joining, make sure you are following me, and also make sure you're tapping on your screen. Yeah. So let's move on. Let's look at the cervix during early pregnancy. The cervix during early pregnancy. That is to say, from conception until late pregnancy, the cervix is sealed with a mucus plug. Beside it being closed like this, there is also a plug that seals it. You know, when you are packaging your product, you still use an outer this thing to seal the the product before you dispatch it. Why? To protect it from tampering and so on. So besides the service being closed, there's also mucus plug that seals the service. And this plug blocks bacteria from finding its way into the womb. Remember I think some 9 years ago, no, not 9 years ago, or maybe less, some 11 years ago, I did anyway, that one is more professional, so it's not for general public. A very extensive discussion with some students on basically what's happening in this cervix. A very valuable part of the uterus, but nobody talks about it. The only time some ladies know cervix exists is when they are going for D&C to destroy the thing. Oh God, may that not happen to you, right? So the cervix in early pregnancy, right, has mucus plug that seals the cervix, and it also blocks bacteria from entering the womb. And this is just nature's biological lock system. The nature knows how to lock up the uterus from tampering, from entrance. Yeah. And without this system of blocking the uterus through the cervix, without that system, infection will rise. Anything that affects that system will amount to increase in risk of infection. Miscarriage also will increase. When I mentioned incompetent cervix, that's what it means. Because the cervix is not really close. Yeah. And you also have preterm labor becoming more likely because this cervix no fit close properly. Yeah. Now, as birth approaches, certain changes begin to happen. That leads us to talking about what we call cervical readiness. Cervical readiness, right? As birth approaches, as you are getting close to the time of delivery, time of birth, the cervix must undergo major changes. Major changes must happen as birth, as delivery approaches. Let's talk about four of those major changes. And the changes that happen, doctor call it a cervical ripening. The same way your fruit ripens on the tree is the same way the cervix needs to ripe before labor. Who is hearing this for the first time? Just carry your hand up like this. Oh no, Betty is here. Who is hearing this for the first time? Just carry your hand up like this. My hand did disappear. Just carry your hand up like this. Have you heard of cervical ripening before? Good evening, Onome Betty. You're welcome. Have you heard of cervical ripening before? Oh boy. All right. Now, let's break this thing down. I tell you, if you don't learn anything today, just tell me, say, Oga, I don't learn anything. I will just give you your heart me back. Because you've got to learn something. There's no need wasting time here if you're not learning anything. Right? So, the changes that happens as labor approaches is called cervical ripening. And let's break it down. I'm going to take there are four of them. I'm going to discuss the four changes. The four changes. I'm going to discuss them. Right? So when I say grab a pen and paper, I know what I'm telling you because you certainly are going to have something to write. Right? So the first change that begins to happen is cervical softening. Cervical softening. Yeah. Early pregnancy, the cervix is hard. And the easiest way to understand how hard the cervix is, touch your nose. Touch your nose. Touch your nose, man. Touch your nose. No, get too much pride. Touch your nose like this. All right, touch your nose. That is how hard your cervix is at your early pregnancy. Your cervix is that hard. Right? So when I say touch your nose, some people say, touch the nose. Use your hand, touch your nose. Don't they get pride? Thank you. So that you will understand practically what I'm teaching you. Right? So this is how hard your cervix is in early pregnancy. Right? Whereas it's approaching birth, as it's approaching Global Uzi, my favorite grandma. Good evening, Global Uzi. Good to see you. You're welcome. Right? So in early pregnancy, the cervix is as hard as the tip of your nose. As I'm touching my own, be touching your own, because if you don't understand, it's still your problem. Right? Touch your nose. Then, as you are getting near to birth, right? The cervix is soft. like your lips. Touch your lips. And I know that some people get strong lips, like especially those where they smoke igbo. Right? But touch your lips, peradventure is kind of soft. Touch your own now. No get pride too much. Touch them. Touch them. Touch your lips. So as you're getting closer to delivery, the cervix is as soft as this. Alright? Is that not practical enough for you to understand? If you're just joining, you're welcome. Just make sure you're following me. Please touch it because it will be easy to understand. Remember, we're talking about cervical ripening, how the cervix ripens like mango as you move from early pregnancy to delivery. It ripens. Right? So, what causes the softening of the cervix? It's very simple. It's very simple. Hormones, basically. Right? Hormones like prostaglandins. Take note, because I'm going to tell you some things that you may never have heard before, but it's going to be very beneficial to you. All those people asking questions, you're asking. Calm down. Just follow me first. Tap on your screen, share the live. When it's time for questions, you have more than enough time to ask your questions. That's how we roll. Is that okay? Right? Now you just arrived. Follow me. Tap on your screen, share the live. Cool your temper. Also carry biro and be writing. Right? So yes, I said the causes of softening of the cervix. Yeah. Is hormonal. And the example of the hormones that plays this role is prostaglandins. Steven, are you here? Can you type prostaglandin in the comment section, please, so that they will know the spelling. Steven, are you still here? Let me see if Steven is still here. What happened? Is it network? Sorry, I'm looking for Steven. Okay, I don't think. Okay, he's still here. Good. Thank you. Thank you. Thank you very much, Steven. Yes, Betty, thank you very much. So, I said hormones and examples: prostaglandins, estrogen, and also your baby. The pressure that is coming from your baby's head is also playing a role in this cervical ripening, in the softening of the cervix. So these three things: prostaglandins, estrogen, and right. So not be today this head don't dey work. This head started working from my mother's womb. I was pushing the cervix, right? so this softening makes it easy for the cervix to begin to open as labor approaches, right? So that is the first one. The second one is cervical thinning. Thin as in thinning. Or you want to say cervical effacement. Right? Cervical effacement. And effacement means how thin the cervix has become. Right? And interestingly, We measure it in percentage. 0% means it's thick and long. 100% means it's it's paper thin. It's a paper thin cervix. Now it's got to be that way because how else will this head pass that cervix and come out? It's got to be paper thin, right? So that you add more knowledge to your understanding, I also have an article on this issue on my blog, right? On my blog, and my blog is the URL is ambaneg.blogspot.com. Of course, you cannot type it here because TikTok will remove it. So I'm going to type it and use comma wherever there is dots, so that I can go there and learn a lot. Yeah. Ambaneg. Go to my blog. So much to learn. What I'm even telling you on the live stream is not up to 1/4 of the information that is on the blog. So just type this on your browser. ambaneg.blogspot.com. Did I put .com? I don't think I did. Ambaneg blogspot.com. Okay, that's the correct one. That's the correct one. Put it on your browser and it will take you straight to the change the commas to dots. It will take you straight to the blog, and so much information. You will see this information on cervix there with some pictures that will give you understanding how the cervix dilates until this big head comes out of it. So the thinning of the cervix is measured in percentage. Now 0% will mean that it's thick and long. Then 100% thinning would mean that it is paper thin. And I said it's very necessary. That is the only way head like this will pass through. It's got to be paper thin, right? But the more important information is, why is thinning of the cervix more important? Why does it matter at all? It matters because a thick cervix cannot open. A cervix that is thick cannot open, right? So whatever you're doing in that labor is you're just doing it in futility. If a cervix is not thin, right, you'll just be laboring for nothing, because a thin cervix will open easily. Remember, it's cervical ripening, so it's soft and it's thin. So as the head is pressing, it's already thin, so it's going to stretch out and begin to allow coconut heads like this to come out. And this thinning, effacement of the cervix happens before dilatation begins. That has to happen before dilatation begins, especially for those in their first pregnancies, right? So that is the second thing. Second change that happens in cervical ripening. Yeah. The third change that happens in cervical ripening is opening. Pretty easy, because opening is another word for dilatation. right? Cervical dilatation. Dilatation is measured in centimeter. For those of you who have gone to the labor ward before, even escorted somebody that is, you hear the nurse saying things like 2 centimeter, 6 centimeter, 10 centimeter. You hear things like that, right? So that opening is measured in centimeter. 0 centimeter means that it's completely closed, right? 10 centimeter would mean that it's fully open and ready for baby, right? So it's from 0 to 10. So if they say it's 2 centimeter, you already have idea. Say it's 6 centimeter, you already have idea. They say it's 8 centimeter, you already have idea. And every midwife know at what centimeter they are really going to get serious with you. And it has stages, right? There is the early labor stage, there's the active stage, there is the transitional stage, right? The early labor stage is when it is in 1 to 3 centimeter. That's early labor stage, right? For those of us who have escorted our spouse to the hospital for delivery, you know how we used to parade the whole place, we walk back and forth. See, if may God bless you with supportive partner. I tell you, it is no longer she is pregnant, is we are pregnant, because you go suffer, right? Unless you want to run away to go and sit down somewhere and wait for the good news, right? All right. Otherwise, you go suffer. So there is the early labor stage, which is when the cervix is opening around 1 to 3 centimeter. There is the active labor phase where the cervix is opening around 4 to 7 centimeter, and there is the transitional or transition stage where the cervix is 8 to 10 centimeter. And of course, no pushing happens until the cervix reaches 10 centimeter. Even though I know that some experienced people do it around 8, 9, 10. So depends. But at least you know what they are saying when they say so. Is that okay? So the fourth changes in cervical ripening. You are just joining, you don't know what we mean by cervical ripening. Sorry, you missed. Don't worry, next time don't miss the live stream or come early, right? So the last change is the cervical position. Remember, if you started from the beginning, remember we said in the early pregnancy, the cervix is thick, long, and is bent backward. Remember? So if you forgot that one, I just reminded you, right? So in the early pregnancy, the cervix usually points backward. Yeah? But as labor approaches, the cervix moves forward, right? It keeps moving forward until it aligns with the birth canal. Is that not remarkable? This is biology that happens, you don't know what's going on. It's not remarkable, right? So this alignment allows the baby's head to pass smoothly. That allows it to pass smoothly. Up until this point, if you understood what I've been saying, type in the comment section. Type understand. Type understand. Because your understanding is more important than even being on live stream. Of what use is being here when you don't understand anything? Right? So if you are just joining, make sure you are following me. You're tapping on your screen and sharing the live. And if you have not dropped a heart, man, What are you waiting for? If I finish the live stream and you not drop a heart me, I think I will begin to twerk so that you will drop a heart me. Just an appreciation. Just an appreciation for. Thank you very much, Saint Grace. Just an appreciation that, hey, what you are saying, we like it. And I want to support you with 1 coin. 1 coin is just 2 cents. So 1 coin is just 2 cents. So 2 cents is too small a, a money to support this thing. This thing you pay hundreds of thousands to hear in your clinic, right? But we are giving you for free. You don't even hear it. Nobody has that kind of time. So be smart. All right. So we'll talk about the 4 changes that happen in cervical ripening. The 4 changes. Right? Who can remind me? For those who have been listening, who can remind me the 4 changes that happens in cervical ripening? Number 1, cervical softening. I think network is slow, so anyway, cervical softening. Number 2, cervical thinning or effacement, depending on what you want to say. But cervical thinning is number 2. Number 3 is cervical opening or dilatation. Then number 4 is cervical position change, where the cervix is moving in the early pregnancy is thick, long, and backward, and it continues to move forward as you approach delivery. Why? Because it has to align with the birth canal for easy passage of the baby. All right. You know one of the things that knowledge does to you, even now that you know, by reason of knowing, the process becomes very easy because you just know this. I'm in this step. I'm in the other step. I'm in the other step. That's what knowledge does. So that fear, anxiety that triggers even your fear and anxiety is a part of the problem you're having during when you are pregnant, right? So if you're just joining, make sure you're following me, tapping on your screen and sharing the live. If you have a question, you want to first follow me, then wait until it's time for question and answers. Is that okay? So where next should we go? Let's talk about something interesting. How does this cervix, remember all the things we said about cervix? So this cervix, how does the cervix know it's time for delivery? How does cervix know? Because its job is to maintain the door. This pregnancy is not coming out, right? So now we are close to labor. How does the cervix know that we are there? It's very simple. Because the cervix does not work alone, right? The cervix does not work alone. The cervix responds to hormonal signals. So if you are here earlier and you heard what I said, those hormones I mentioned that participate in the first change of ripening of the cervix. So hormonal signals, it responds to it. It also responds to the baby's weight and pressure. You hear this, oh, here is heavy, I'm feeling the weight here, and this is still part of the thing. You fear too much. Calm down. All right. But that's why when you have a partner or your doctor will reassure you, don't worry, Don't worry. It's part of what's going to help the process. Is that okay? So the cervix responds to the baby's weight and pressure as it puts its big head down there. It's also helping in the changes that should occur before labor. The cervix also would respond to uterine contraction. This uterus is a very wonderful structure, but I'm not going into those details today. So when the contraction begins rhythmically at regular interval, the cervix also respond and say, hey, something is happening upstairs. Maybe they are telling me to begin to open, just like say, Musa, Musa, open the gate. I want to go out. Something like that. Nothing where Musa no go see for gate, I tell you. Saronia, how are you? Good to see you. You're welcome. Right? So it responds to uterine contraction. And also there is also the aspect of the mother's brain communicating with the uterus. These are all the parts you don't get to see, but it happens. So the mother's brain is sending message, say, hey guy, time don't they reach you. So just one of the arrange, one of the prepare. It's time for us to complete our job. We've started, we've done a good job. It's time for us to finish it. So the brain is sending that message down there. So besides the brain, there is hormone talking to the cervix, there's the baby's weight and pressure, there's uterine contraction, all of them as a team having that communication. Say, hey, it's time. This is why, for this reason, is why labor cannot be forced. One of those people that goes to do Boca medicine. Boca is an Hausa word for native medicine, right? Where you go there, they don't understand anything about the cervix. Just because you are shouting, "Aye, aye, aye," they already think that it's time. Oh yeah, push what? You don't even know what's going on. Oh boy, oh boy. So if you understood anything I just said today, you understand that labor cannot be forced easily. You can't force it easily, right? Labor cannot be forced. Jody, Dr. Jody is here. Welcome. Everything about the process, nature has timed it. The same way nature times the conception. So those of you that are coming, they say, "Oh, doctor, I want to get pregnant in 3 weeks' time." You are wasting your time. I don't do magic. I'm not a magician, right? Biological process has its timing. You want to skip it? Of course, I don't like money. You give me the money now, I'll just deceive you, and yet nothing will happen. Have they not done that to you before? But people don't like truth. When you tell them truth, it is you that is telling them truth. They don't want to pay. But if you blow lie with BB grammar, say, this doctor know what they talk. Oh boy. Anyway, I said all that to say that the cervix knows when it's time. The cervix knows when it's time. Right? Now that moves us to the next aspect of the gist. Right? Which is, I mentioned mucus plug earlier. Let's talk about it now. Now, besides this cervix closing, there's also mucus. That reason why you should listen to me, Saronia. Reason why you should listen to me. Mhm. And just in case you have been sitting down watching African Magic all this time, it's not going to work. Oh. You've got to move around, get active. My own day is to come for sooner and chop tuwo and drink fura de nono. That's all. Apart from that, I don't have any other role to play. Right? So my job is to come for your naming ceremony and enjoy. I will not be there when you are pushing. I will not be there when you are shouting. And if I'm there when you are shouting, I carry something to cover my ear. Right? All right. So where was I was talking about mucus plug. And nature puts the mucus plug around the cervix to protect it. Not protect the cervix, to protect the uterus from bacteria coming in or any other thing that is not supposed to go in. Right? So as the cervix begins to open, now labor is coming. The cervix is beginning to open. That mucus plug will loosen up. It's a thick plug. It's a thick plug. Mucus. You know what mucus is? I don't know another word. Pidgin English does not have it. Kata. Yes, that's the way to call it. Yes. Kata can be thick and it can be loose. So the one is thick when you're pregnant, thick one to cover that place, cover the cervix. So as um what was I saying now? I said as the cervix begins to open, that mucus plug will loosen up. Loosen means it's not as thick as it is. So it loosens. It loosens up. And it may even come out as thick mucus or pink mucus or blood stained discharge. All this I just mentioned is what people call show. Not you people, it's what we call show. Right? Right? Why? Because the cervix is beginning to open. The relevance of that mucus plug has been outlived. So you have to move to the next phase. And this is important because losing the mucus plug also enforces the fact that the cervix is opening, right? And does not mean that labor will start immediately, right? That you see show does not mean that labor will start immediately, even though depends on the spectrum where you are. Uh-huh. Depending on the spectrum where you are. So labor may begin some days later. Labor may begin that same day, even in weeks later, after the plug, the show has come. Right? So if you are here, you're welcome. It's only when you see the show, it only means that this service is ready and is changing to allow the baby to pass. Right? Up until this point, if you understood anything I've said so far, just type ready in the comment section. So let's go to the next thing. The next thing is a little bad news. a little bad news. Sometimes the cervix may misbehave, right? Service Sometimes the cervix may misbehave. And let's look at a few things about cervix misbehaving, right? Basically, two major things. Can we go ahead? Can we go ahead? Let's talk about the cervix misbehaving. And the first misbehavior is what we call incompetent cervix. Incompetent cervix. This is a situation, or you want to say weak cervix, if you wish, to make it simpler. Weak cervix. This is actually a situation where the cervix opens too early without pain. The cervix opens too early without pain, and this leads to miscarriage or preterm labor. Can somebody talk? The risk factors for this incompetent cervix is previous cervical surgeries. Right? Trauma. Trauma. And of course, there are people who were born that way. They have this congenital weakness. They were born, they've never had a solid cervix. So those ones they were born that way, it's not anything that they did wrong. But when it comes to trauma, those people that do D and C like water, I feel very sorry for you, right? Augustine, right? So we're talking about incompetent or weak cervix, and I said it opens too early without pain, right? It leads to miscarriage or preterm. So I think to catch a coin in the goodie bag, you must share the live. So go to share, tap on share, so that you can participate in the goodie bag and get one or two coins. That's how to get a goodie bag. I know some people are new here. Don't let those who are already experts here collect all the coins and run away. So collect a coin by sharing live. All right. So the risk factors I said include people who had previous cervical or cervix surgery, those who had trauma, and I was warning those who are doing D and C like water, right? I'm warning you, you want to change, you want to repent, you want to repent, you want to repent because you are doing harm to yourself, all right? And also there are those who were born that way, congenital cervical weakness. They were born that way. They didn't do anything wrong. Right? So the treatment for this is just very simple. Cyclage. Have you heard of cyclage? Another word for that is cervical stitch, right? Where they hold the cervix tight so that the pregnancy does not fall off. Progesterone can be given, of course, close monitoring. Right. So if you are just joining, you're welcome. Make sure you're tapping on your screen, please. Hello, you are welcome. Is that Umbalu? Umbalu, you are welcome. So the next one is the next bad news for cervix is the cervix that refuse to open. What kind of problem is this one? The tendency for cervix is to open as you approach delivery. But some of these cervix will just be stubborn. It's not open, right? What could cause that? What could cause the situation where the cervix refuse to open? Hormonal imbalance. Remember those hormones we mentioned earlier? Hormonal imbalance. Previous scar could have, or yes, could have lived um, um, uh, previous surgeries rather would have left scars. And remember, scar tissues are not tissues that are elastic, so that can cause the problem. And the one that applies to you the most is fear and stress. What did I say? Fear and stress. Surround here, are you here? Talk to me in the comment section. Because if you are not hearing this, I wonder where else in the world you would have been by this time. Because this information is for you. Right? What did I say? I said when cervix refuse to open, it's time. Cervix now is refusing to open. This can be due to hormonal imbalance. It can be due to scar tissue from surgeries, previous surgeries. It can be due to fear and stress. That's why I was calling your name. No fear and don't stress yourself. Right? That's how biology is designed. Every aspect of your life affects something about you. Fear and stress. And when, of course, there is poor contraction. So these are the things that could cause the cervix to refuse to open, right? And this will result to prolonged labor. Only one person collected coin. The rest people don't need coin. Steven, you're no longer here. Okay. Anyway, so this failure to open can lead to prolonged labor. See people going for having labor for days. What's happening? We're just waiting for service. Service has become prayer point. In the name of Jesus, I cast service. I bind service. I bury it. All the arrow for service, I throw. You keep on praying and praying. Service. Right? So, service is refusing to open. What are we going to do? What shall we do? It's refusing to open. So that's where the need for induction and cesarean section would come to bypass the trouble. Is that okay? Right? So everything that we've said are the kind of things that will be observed and things that you need to do to help yourself. Right? So a quick one before I start answering one or two questions before we go actually. All right. What you can do naturally to support cervical readiness or cervical ripening. Who's ready for this gist? Please talk to me in the comment section. Just type ready. Who is ready for this gist? What you can do naturally to support cervical readiness. Oh boy. You'll be amazed. You'll be amazed. So what you can do naturally to support cervical readiness. Ready. Let's talk about it. The first thing Walk, walk. There's this song. Can I remember that song? I I can't remember. It's something like I walk, no one, no, something like that. I can't remember the song. So encourage yourself and walk around, walk. That's why when you go to the clinic, see those people in labor, they will walk around the whole nook and cranny of the clinic. What are they trying to do? Supporting cervical readiness for the labor to happen. If you are just joining, you miss too much information. But nonetheless, don't miss the live stream moving forward. You can also do gentle exercise. You see, that's what I was saying. If you are just there from the beginning of your pregnancy, watching Netflix and chills, watching African Magic, crossing your leg, you're just sedentary. I'm sorry for you. I'm sorry for you. So walking, gentle exercise, adequate hydration. You take water, right? Adequate hydration. Relax and reduce fear. Calm down. What did I say? Calm down. Cool your temper. Relax and reduce fear. Fear not. Akosua. Akosua. I thought you've been following me before. Anyway, you're welcome. Right? Relax and reduce fear. Come closer. Let me tell you something. In your ear, for only those that are pregnant. Right? This one is only for those that are pregnant. Let the viewers eye reduce more. I'll say it. So those people that are tired, let them just go. I'll say it. Right? But I'll just jump it for now. Good nutrition, of course. When you eat well, these are the things you do to help. But this last one, I want to see the viewers eye drop, then I'll say it. Right? Because it's amable. I want to do small amable with pregnant people. Instead of viewers eye to drop, it's going up. Come on, man. These people they go like amable for this Africa. Men mount. Nobody green move. Nobody green move. Nobody green move. Men mount. All right, you last one. Come closer. Sexual intercourse. You got to knock. Knock waiting no good. Oh boy. What did I say? Knock waiting no good. That is the that is one of the things you need to do to support your cervix to be ready naturally. I don't go say go knock boss the pikin head though. That's not but knock waiting no good. Right? Do that. It will help you naturally to support cervical readiness. Is that okay? Above all, besides everything I've said, always follow medical advice. Right? Give you they advise you on what you should do, follow the advice. Don't believe in your own thing. That person A, B, C succeeded in doing their own thing does not mean your case will be the same. So follow medical advice. Right? All right. So somebody asked one time that is it that strong contraction will guarantee delivery? Uh, Cervix must not cooperate. Strong contraction does not guarantee delivery because cervix must only respond when all those things I mentioned, contraction, hormones, um, and these things I mentioned, right? So these are the things put together that will help the cervix to cooperate. The early dilation does not mean the baby will come now. All right, you can go to the clinic and say, "Ah, madam, you are you are 2 centimeter." Then in your mind, just okay, 2 centimeter now. Maybe in another like 5 minutes or ten. Sorry, another 5 hours, it would have reached 10. It does not work like that. So it's not a guarantee. Um, 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 um. And I think some women even stay 3 to 4 days. 3 to 4 days, not 3 to 4 days. Um, they stay for days maintaining a particular centimeter, 4 centimeter, 3 centimeter. It's just not moving forward. All right. The cervix opening does not equal pain. Not because the pain is increasing, therefore you say the cervix is opening. It does not work like that. Opening can happen quietly without pain. So it's not the pain that is causing the opening. It's everything I said earlier. So the dilatation, opening of cervix can happen even without the pain. It's just to make progress. You know what some women call um, Hebrew woman delivery, right? And they felt something, but it's not the kind of pain. So cervix can open without that. Now, if your partner is with you, listening to you, or they are going to watch football, as the case now, um, you can tell the message, take the message to them, right, of what they should do, what is their role in this business. They are supposed to help you reduce anxiety because pregnant women they fear for Africa. Right? They can help you to reduce anxiety. They can encourage your movement. Like I said, you get to walk around. You can be part of the walking, encourage your movement, can provide that emotional safety. Everything will be all right. This is our journey. We are pregnant. We're going to deliver this thing safe. We're going to be good, right? I'm going to be there with you till the end. But no slap me, oh, no tear my shirt, oh. But I'll be there, right? Also, um, every other thing they need to do to support the process. Can I tell you another secret? I said it before, but maybe you just did not catch it. Fear. Fear tightens the cervix. You will not hear it anyway, but I've told you. Fear tightens the cervix. But when you are relaxed and you are in some level of reassurance and safety, the cervix will just go like this. Right? So if you have been listening to me all this time, it's just simple. What I've been talking about is the service. Thank you very much, Mommy D. Right? What I've been talking about is the service is small, the service is silent, the service is powerful. And this service can decide when labor begins. The cervix can decide how labor progresses. The cervix can decide whether the birth is smooth or difficult from everything I've said up until this time. All right. So understanding the cervix will help the parents work with nature. Remember, you cannot bypass nature. All you can do is to work with nature. I saw a case, a very terrible case last year. Very terrible. You know, this individual. Don't fight nature. That's the advice I'm trying to give. Don't fight nature. And please let professionals handle your case. This woman, she must have come from the rural area. I was just there doing my thing, Then I was called upon to come to the labor ward. The lady that has been, from wherever they are coming from, has been battling with labor. All those people practicing Boka medicine. Boka means traditional in Hausa language. Right? Battling with labor. Now she got here. I haven't watched her for a little while. Just know that this woman is already just weak, frustrated, tired, and at some serious risk. Even the baby, all her vulva are swollen, yet the cervix is just like this. How does Igbo people call it? They call it odeshi. Nothing they happen. I need a move, right? And that is tantamount to uterine rupture. You see, may God help you that bad things don't happen to you. That's why you value some of these things we are talking about. So they call us, we need to see what is going on. Even when we eventually did the ultrasound scan, even the pikin they don't tire. The baby is tired. The mother is tired. Uterus is at the verge of rupturing. Anyway, long story short, cesarean section, baby saved, mother saved, everywhere good. So be careful with your life. Have knowledge. Make the right decisions. That is the way to go. And we're always here for you to advise you, guide you, and help you with knowledge that will be beneficial to you. All right. If you have a question, this is the time. Send your request. Come and ask your question.